Ability to fix infrastructural decay, payment of health workers, hazard and inducement allowances. Ahead of Edo governorship election, INEC meets with police, political parties and other election stakeholders for free, fair and safe elections during the pandemic. And a one-day rise in the number of new coronavirus cases confirmed around the world. According to the NCDC, phase 3 ease of the lockdown does not mean that the COVID-19 outbreak is over. The Nigeria Center for Disease Control says to take responsibility as guidelines are updated to protect yourself and your loved ones. The center, for the first time in almost 5 months, confirmed Nigeria's COVID-19 infection, the lowest daily count at 79 cases last night. The new infections were recorded in 12 states and the Federal Capital Territory, with Lagos recording the highest at 30 cases. The NCDC also reports that 4 deaths were recorded last night, one in Delta State, another in Kaduna, Ogun, and one in Ondo State. 64 persons were discharged in the last 24 hours in 9 states and the Federal Capital Territory. Before Sunday's record, the last time the country recorded less than 100 new positive samples was on April the 27th, when 64 cases were confirmed. At that time, Nigeria had less than 2,000 cases, out of which 251 patients had recovered and 40 persons had died. However, since April, the daily cases of COVID-19 had increased, and by the 20th of August, Nigeria had crossed the 50,000 mark confirmed cases. Till date, the total cases in the country stands at 56,256. Recoveries 44,152, and the death toll put at 1,082. The leadership of Nigeria's Joint Health Workers Union, JOHESU, has made good its strike threat, directing its members to withdraw their services and embark on a nationwide industrial action today. According to the union's leadership, there is no going back on this decision reached after its expanded National Executive Committee meeting held yesterday. JOHESU says it gave the federal government 7 days to address all lingering issues, but nothing concrete has been achieved. The Minister of Labour and Productivity, Dr. Chris Ngige, had on the 10th of September asked members of the union to shelve their plans for industrial action or face sanctions. The health workers are asking the federal government to address the failing and decaying infrastructure in the health sector, payment of the shortfall in COVID-19 hazard allowances for their members, and also all salary arrears.
Until you hear from us, please resume to your respective offices or not.
Meanwhile, in Abeokuta, the Ogun State capital, members of the Joint Health Sector Unions joined the 7-day warning strike declared by the national body of the union to press home their demands after a congress held at the premises of the Federal Medical Center, Abeokuta, the state capital. Members decried the decay in various government hospitals across the country.
The infrastructural decay in our various tertiary hospitals in Nigeria, which we are not in agreement with, because we are here not because of anything, because of the interest of our patients. And if those facilities are not there, how do we expect our patients to derive better services in our various hospitals? Today you will discover that there are a lot of people traveling abroad because of health care service, because they could not believe in what is in operation in Nigeria. And we are telling the federal government, if things could be done right, there is no need of traveling abroad for any healthcare services.
Bayelsa State, a similar occurrence. The chairperson of JOHESU, Bayelsa State, flanked by members, insists that they would embark on the indefinite strike at the end of the 7-day strike if the federal government does not address the issues raised.
The issues that are really making us to go on this 7 days warning strike is: 1, correction of errors of inducement and hazard allowance paid to our members. They were supposed to have been paid 50% across board, but some were paid 50% and some were paid 30%. 2, payment of April and May salaries withheld by government in 2018. Third one is coins adjustment table. This is a table that is meant for the health workers. We have 2 tables. One is for the doctors, one is for the JOHESU people, aside of the doctors. Now they have reviewed it for the doctors twice, in 2014 and in 2017, upward. Now, we have been agitating for ours to be reviewed, but they have failed to do that.
Let's go over to Nasarawa State, where our correspondent brings us this update on the compliance to the compulsory use of the face mask. Here's Halima Gayam with more.
The use of face covers are considered one of the safest bets for protection against the coronavirus. But in Lafia Metropolis, despite an imposition by the government on its compulsory use, residents have continued to flagrantly defy such directive among other safety protocols. On the streets, the use of face covers is almost absent. Social distancing is non-existent. Residents go about their businesses unmindful of the fact that the coronavirus has not vanished. Most of them seem not to believe in the existence of the virus. Some of them share their thoughts with us on the way forward.
I've not been seeing people wearing it here before. When I was in JOHESU, we used to wear face masks in JOHESU. But here, as I come back home, I saw everybody nobody is using the face mask here. I don't know why.
Government are trying their own best, but the traditional and religious institutions have to work more on this, because most people within this axis believe in what their own religion leaders tell them.
Well, it is undisputable that fighting the coronavirus is a collective responsibility which requires that all hands come on deck as the government plays its part. Residents also have their own parts to play to slow the spread of the coronavirus in the state as it edges towards 500 confirmed cases. Halima Gayam for COVID-19 update.
Today, the Presidential Task Force on COVID-19, while acknowledging the decline in the spread of the virus, is warning Nigerians to remain vigilant. Chairman of the task force warns that vaccines may not be available before the second quarter of 2021. He says the national response by the government has been applauded by Nigeria's development partners and that government will remain focused, calling on JOHESU to call off the ongoing strike.
We therefore call on JOHESU to stand up to be counted at this critical moment, because a continuation of the strike could jeopardize the small gains made in the fight against the virus and the efforts to transform our health systems. Buku said that our national response under the guidance of Mr. President is achieving impressive results, and this has been commended by our development partners. Reports have, however, shown that diagnosis and treatment for chronic conditions are among the most frequently disrupted health services globally. A rapid survey by the World Health Organization revealed that 41 countries in sub-Saharan Africa have reported disruptions to such services. It is of great concern to find that just when people with hypertension and other chronic conditions need support the most, many are being left out in the cold. The Presidential Task Force therefore urges the various medical facilities not to neglect patients with other conditions on account of COVID-19. However, we do not expect vaccines to be available for countries probably till the second half of 2021. What this means is that we need to do more than ever before, adhere to the prescribed non-pharmaceutical interventions, and diligently avoid contracting the virus.
Okay, sir.
As early as 7 a.m. today, the Academic Staff Union of Universities, JOHESU, and the Non-Academic Staff Union of Universities, NASU, gathered at the entrance of the Lagos State University, preventing both students, lecturers, including the Vice-Chancellor of the university, from gaining entrance, a situation which affected free vehicular movement in the area. According to the unions, the increment in salaries was promised by the Lagos State government to its workers more than a year ago, but all attempts at dialogue with all parties concerned have not been successful. This is coming after the Lagos State government weeks ago announced that tertiary institutions in the state will resume today, September 14th, after being shut down for more than 6 months due to COVID-19. Joining us right now from River State via Skype is Dr. Betty Agala. She's a public health physician, President, Medical Women's Association of Nigeria, River State branch. Thank you for joining us on the program.
Thank you for having me.
I want to begin from following the adequate infection prevention and control measures in healthcare facilities. If you think that we have put things in place to reduce the spread of COVID-19 from what you've observed and, from what we're hearing, the Presidential Task Force on COVID-19 today, for example, still said that states are way behind in terms of testing, the daily testing that they're supposed to be bringing in.
Yes, thank you very much. So from where I stand, I would say that some facilities are observing while some are not doing so well. But I want to say that it's a continuous process. It's something that has to be done continuously. It's not a one-stop thing. COVID, of course, is not over. And even if the numbers seem to be dropping, there is still the risk of the infection. And so facilities, health workers are encouraged to ensure that they continue to follow the infection prevention and control strategies that have been put in place. So from time to time, of course, we know as human beings that some standards are dropped, but basically it is not uhuru yet for us. And health workers in the facility have to ensure that they have a high index of suspicion, so to speak, and ensure that they identify early and control sources of COVID-19. And to do that, of course, you must screen everybody that comes in, ensure that you identify on time. And of course, when you do so, you isolate and then you notify the relevant authorities. So there's been a lot of training going on, training, retraining, supervision to ensure that these are happening. And of course, in facilities, most of them have been trained, and there is an infection prevention and control focal person who sees to the day-to-day ensuring that the hospital or the health center or whatever health facility is following the processes of infection prevention and control. This is very key because we are still having the numbers, even if it looks like we have relaxed, but COVID-19 is still very much around here.
All right. We'd like to thank you so much, Dr. Betty Agala. Straight to the point, she's a public health physician, President, Medical Women's Association of Nigeria, River State branch. Thank you for joining us on the program. We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. Ahead of preparation towards the Edo State governorship election this Saturday, the Independent National Electoral Commission, INEC, met with other stakeholders in Benin City towards a free, fair, safe and credible election. Participants at the event include the chairman of INEC, Professor Mahmoud Yakubu, the Inspector General of Police, Mr. Mohammed Adamu, the governorship candidate of the People's Democratic Party, his deputy, among others. Our correspondent, Shiwan Kibaloyi, was monitoring during the election fever in Edo State and was also at the event. He gave us a sense of the meeting's objective.
Preparations ahead of the election have come under review here, where questions are being asked by candidate and political parties on the preparations of INEC and what the police will be doing differently in that regard. The police, Inspector General of Police, had warned of any kind of violence. It says that the police will not allow such to happen. There's also warned parents to ensure that their words are being instructed not to cause violence during the election. There's some of the development that INEC chairman and some of the new information coming into this election. A major one is the fact that the timing for the exercise of the election on the election day has changed from 8 a.m. to 8:30 a.m. in the morning, and the election will now end at 2:30 p.m. as against the initial 2 p.m. as we have it before the COVID-19 period. And some of the other issues that come to the fore this afternoon in this room is the fact that INEC is going to deploy technology into this election. One of those issues that have been raised is how that will happen, and INEC chairman said that Z-Pad, a tablet, will be deployed for voter accreditation, and also there will be tracker on vehicles that are moving equipment, are moving materials and results around so that they can be tracked. INEC chairman also updated that the sensitive materials will be leaving Abuja to arrive Benin City today.
Also, a shift in time for elections from the usual 8 to 8:30. Of course, the compulsory use of the face mask when going to vote, the physical distancing, which must be in place, and several other measures, the new normal for voting in Nigeria. Well, the number of coronavirus cases around the world is still rising as the World Health Organization reports there are nearly 30 million cases and the death toll inching closer to 1 million. And this is just 6 months after the WHO declared COVID-19 a pandemic. It's still surging in many countries, and some that had some success in suppressing initial outbreaks are also seeing infections rise again. Here's the global update.
The US continues to be the country with the highest number of coronavirus cases in the world, but new cases are said to be falling and are down by 44% from the peak on July 16, when more than 77,000 new cases were reported. However, Midwestern states are seeing a spike. North Dakota, South Dakota, Missouri, and Iowa last week reported more recent cases per capita than all other states. Until now, the Midwest has avoided a surge in coronavirus cases. Meanwhile, in Britain, new restrictions banning social gatherings of more than 6 people went into force today amid a rise in coronavirus infections. The government said the new measures will ban large groups meeting anywhere socially, but will not apply to schools, workplaces, funerals, organized team sports, or weddings. The rule of 6, which differs slightly in Scotland and Wales, will be enforced through a £100 fine if people fail to comply, doubling on each offence up to a maximum of £3,200. Head of Paris Hospitals has warned that the number of COVID-19 cases doubling every 2 weeks in the French population could end up with more care units being saturated. France, like every other European country, has faced a resurgence of novel coronavirus, leading the government on Friday to promise steps to speed up tests and toughen measures in high infection zones to avert a return to the general lockdown imposed earlier this year. Former Italian Prime Minister Silvio Berlusconi left hospital today after overcoming the coronavirus, saying he survived the most dangerous challenge of his life. A smiling Berlusconi told reporters, "I said to myself with satisfaction, once again, you've got away with it again." The 83-year-old media tycoon had come down with pneumonia and was considered a high-risk patient because of his age and underlying health conditions, including heart problems. Finally, Kenya is set to begin trials of a COVID-19 vaccine developed by a British company in partnership with Oxford University. The trials will target hundreds of health workers who are on the front line in the battle against COVID-19. These are the people that will be among the first participants in Kenya to take part in clinical trials for a COVID-19 vaccine being developed by AstraZeneca in partnership with Oxford University.
We'll take a further look at our website, channelstv.com. It has the latest updates on the pandemic. All you need to do is access the stories there. You can find several other news as well, but the leading story there is the WHO warning of increased deaths in Europe as daily infections continue to rise. There's also the sub-story there of Pope Francis, who's constantly being monitored for COVID-19. That's coming from the Vatican. And as millions are returning to school in Italy, this is after, of course, the COVID-19 closure. And, of course, the fact that Nigeria recorded 79 infections, its lowest in 5 months. It's also a sub-headline there as well. It's channelstv.com. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwoka. Stay safe.